regarding randomized controlled trial, it is basically a trial, and group of patients are randomized to either receive or not to receive intervention. The outcome is later on compared in a prospective manner. It consists of some important step, that is randomization, addressing bias, addressing confounding factors, and masking. So randomization is a process. So in randomization, the prognostic variables are both known and unknown are distributed equally into the groups. This can be done by simple randomization. A simple randomization is a computer-generated tables, and this method has not been appropriate in small trials, as it doesn't ensure that each group will have same population. Then it's stratified. Stratified is basically that blocks the stratified is basically ensure equal distribution with each treatment groups. Only 2 or 3 variables are stratified, like age and sex. It is particularly only in large trials and should be performed by each center in multi-center trial. Then it's blocks. So a block is basically set of block is given, and each number of patients are assigned to each treatment. For example, if a block size is 6, then 3 receive treatment A and 3 receive treatment B. Then bias. Bias is systematic error in methodology, which is potential to affect the results. Bias is reduced in several ways: randomization, masking, and masking or blinding, and meticulous, rigorous attempt to continue the follow-up protocol and reduce the bias. Bias can be of different types. Selection bias. So then it can be publication bias. It can be ascertainment bias. It can be recall bias. It may be systematic bias. It may be observer bias. It may be verification bias, or it may be information bias. Confounding factor. A confounding factor is a variable which is independently associated with outcome and the exposure, and can confuse the outcome results. For example, gray hair in osteoarthritis. Confounding can be reduced by matching or measuring. That is, stratification can be done looking at both different ages and with or without gray hair color. Masking. Now, masking can be single masking, only patient is blinded, double masking or double blinding, both patient and investigator are blind, or triple blinding, where the treatment is not known to be the patient, investigator, and the statistician itself.